Hello, I'm Dr. Laukkanen, and I'm going to be discussing the experience of breast radiation and possible side effects. Thanks for joining me. And if you're watching this in anticipation of a consultation visit with me, I look forward to meeting with you. So, when a person has radiation treatment, they have a series of visits, and the first treatment is the longest one, and it's simply so that all of the checks can be made to ensure that the treatment is carried out exactly as prescribed. So, the first day visit can be from 30 to 45 minutes, but then after that, standard breast treatments, whole breast, take 15 minutes in the treatment room and up to half an hour if a partial breast treatment is being done. The actual treatment time is pretty short, just a few minutes. So most of the time in the room is related to positioning, checking, and so on. When the treatment beam is on, it's no different than an ordinary x-ray, so you don't feel anything. The treatments are given on a daily schedule, 5 days a week. And there's a few different overall prescriptions, and so the treatment can vary in total from 1 week to up to 4 weeks. Even though they are different schedules, they in fact have quite a lot in common as far as the normal tissue effects, and so side effects tend to be quite similar. So if we imagine a person having, say, a 1 week course of treatment, during that treatment week, they may notice relatively few side effects, then more in the second week, third week, and then about the same in the fourth week. And then over the subsequent 3 or 4 weeks, that uh, things would gradually get better until they were settled. And again, whether a course is just 5 treatments or as much as 16 to the whole breast, the side effects gradually increase over 3 to 4 weeks and gradually settle over the same period of time. And to look at what people experience, the first and most visible thing is the change in the skin, and it can be described as being like a sunburn. The second is in the breast itself, where because of an accumulation of tissue fluid, there's variable warmth, fullness, and swelling, and possibly some tenderness. And for the skin changes, every person is unique. Some notice relatively little with some skin itching and tenderness, uh, but for a few, the skin effects can be quite bothersome. There are certain areas that are more at risk for irritation. So first with the skin, the color more tanned, especially if a person has a background of a more pigmented complexion, and then pink or red changes, and the skin can become dry with some dry peeling, just as a sunburn does. And occasionally, if more skin layers are lost, especially in friction zones, uh, the skin can get down to that area, that layer that's moist. And if that's the case, special care is applied to that. And the skin fold under the breast is a particular area, and especially if the breast is larger because of the greater friction effects there. So let's just look at that in more detail. The friction zones normally, where skin is applied to skin, there's always repair of the skin going on, and that orderly repair doesn't happen during radiation treatment, but it picks up after the treatment is finished. So we're going to look at three pictures. The one at the top right shows a radiation design model, and where the pink line is the lower margin of the breast. The yellow line shows the lower margin of the radiation beam, so you can see that there's a little space below the breast that has to be incorporated into the treatment area. The lower picture on the right shows a person's breast, the lower fold, and as you can see, where skin is applied to skin, there's going to be that frictional effect. And the picture on the left is a close-up of the area in that fold under the breast. And what one can see is that there's some increased pigment where the skin is more irregularly brown. We can see areas where the top skin layer has been uh, peeled away. and that area in occasional people can progress even a little bit deeper. It all resolves with special care. And just to illustrate the variability of radiation effects, on the left one sees just a bit of mild redness and fully intact skin, whereas on the right there's quite intense redness, and one can see that some skin surface layer has been displaced. Importantly, all those things settle down over a few weeks. Looking years down the road, sometimes there can be a subtle remaining change in the amount of pigment in the skin, and occasionally tiny blood vessels can be evident, especially if the radiation doses had to be elevated to an area, for example, if a so-called breast boost is given near the surface. As far as the breast itself, that tenderness and fullness can sometimes linger for a number of months. It's usually mild and not really interfering greatly with a person's sense of their quality of life. Some people find that their energy is down during and a little after treatment, but it depends very much on the person. Of course, just going to a hospital every day, even if it's for 5 days, can be tiring and have a carryover. As far as that persisting tenderness, it's more likely if there was tenderness after the surgery, and if the breast size is larger, and if there's extra tissue fluid in the breast after surgery. And up to 10% of people can have some degree of persisting tenderness, although typically by a year after the treatment, it's a very rare phenomenon. Now we'll look at other more uncommon and delayed side effects, and they can be traced to a different effect of radiation on normal tissues, which is the tendency to cause some microscopic fibrous or scar tissue to form within the tissues. So if we look at all of the normal tissues that are in the radiation beam, obviously there's the skin that we've discussed, the breast and the surrounding soft tissue, the rib cage, and the underlying lung. And we'll look at each of those. So with regard to all of the skin and soft tissues, there's always the remote possibility that although the radiation prescriptions are designed so that the normal tissues can handle them, that a person could have much greater than average normal tissue radiation sensitivity. And so more of the scar tissue would be laid down, and that tissue would not be healthy. It would be perhaps contracted, firm, and more vulnerable if subjected to injury or infection. I have never seen that in my practice, and I have seen 2 cases that have experienced that in other practices. So it's a distinctly rare event. Now, turning to the deeper structures, the rib cage, the ribs under the breast receive radiation treatment, typically handle it just fine. As we age, our bones get thinner, and in theory, radiation can predispose the bone to more thinning in that area. But if a person has an overall proactive approach to osteoporosis prevention and management and tries to keep a head on their bone density, they wouldn't be expected to have a radiation-induced rib fracture that can cause symptoms. Next, if we look at the little rim of lung tissue that lies immediately under the breast, it's exposed to some radiation, and the average air sacs in the average lung don't mind. But in a small percentage of cases, those air sacs can react with inflammation. And so one has what's called a radiation pneumonitis. So like a pneumonia, but not caused by infection, rather an inflammation caused by radiation treatment. And that in turn can lead to some scar tissue formation. Now, with a standard breast treatment, it's very uncommon. Depending on how one looks for it and defines it, it could be as uncommon as less than 5 in 1,000, or as much as 2% if large lung volumes, for whatever reason, have to be incorporated. And we'll talk about that a bit more. Heart effects are only significant on the left side, and indeed there's a fair amount of controversy about how much radiation in the current treatment system can contribute to any long-term change in heart function. As far as delayed cancer risk, Radiation, of course, is known to be able to cause cancers, but if one goes looking for it with therapeutic radiation, in fact, is very hard to find. One area where there's a demonstrated association is in lung cancer in people who have been smokers and who continue to smoke. So in non-smokers, discontinued smokers, that association is not seen. So important not to smoke. There's always the extremely remote possibility that more radiation than prescribed could be delivered, and that itself could cause issues with normal tissues. But because of all of the checks and balances in these radiation machines and prescribing, that risk is less than 1 in 100,000. Just going to look for a moment at radiation effects on the lung. If we imagine a radiation beam skimming across the breast, as is shown in that cross section, where you see the purple arrows, there's that little bit of a irregular fringe there. That's radiation having caused inflammation and some scar tissue on the outer aspect of the lung, just deep to the breast. And most of the time, a person would not even be aware of that. If there is inflammation causing a cough, that's treatable. Final point I'd like to make is that we've been looking at radiation of the whole breast. If the partial breast is treated, a smaller tissue volume, generally speaking, there would be fewer effects. And for people for whom the partial breast radiation is appropriate, that's a good thing. So to summarize, breast radiation definitely causes skin bother to everyone and some breast tenderness for some. Very few people are likely to experience any significant delayed radiation side effects caused by microscopic scar tissue formation, but rarely these events could happen. Thanks very much for your time.